Okay, look at that comment. So I understand how evaluation and management can be a little bit tricky. It makes it a lot easier if you have an organization that is supportive and is able to give you some kind of audit tool to help you. AAPC used to have an audit tool out there. I don't know if they do at anymore, but it's definitely worth checking to see if there is an audit tool available for AAPC. I am going to make one and post it in my stand store. I'll try to get it done this week. If you guys are ever interested, by the time you watch this video, it may be loaded. So you can check that out if you're ever interested in understanding how to come up with MDM leveling. But I'm going to attempt to explain it in this video. It's really hard when you're not reviewing actual clinical note. So I'm going to use the example of like a cold and asthma, and it'll hopefully all make sense by the end of the video, and it'll only have like 10 minutes. So I'm going to try to do this as quickly as possible. Okay, so the easiest thing to do is when you have a time statement written in the documentation, that's easy. The provider documents the total time they spent with the patient. You look at the total time spent with the patient, and you go to your CPT book and see what total time corresponds with whatever level is in the book. That's easy peasy. It doesn't matter. The provider says they spent this time with the patient, they called it total time. That's the code that you pick. If the provider did not document or attest to the total time that they spent with the patient, then you will have to level. Either you will have to decide if you agree with the level that the provider picked, or you will have to level it yourself. So here's how you can do it. Now, we know that there are basically 5 levels that you can give, one being the nurse visit, and the other ones is level 2s, level 3s, level 4s, and level 5s for the most part. So there is a few questions that you have to ask yourself when you're leveling out the encounter. First, do you think that it's a low level or high level? What range? The second question you have to ask yourself is how many problems and how complex are the problems? So how many diagnoses are the provider treating or has diagnosed the patient with, and how complex are those diagnoses? The second question or third question you will have to ask yourself is how complex the data is that the provider is analyzing or reviewing. Meaning, like, how much labs, how much tests, how many, historians are they listening to? Are they looking at other medical records from other providers or other specialties? And then the last question you will have to ask yourself is, what is the risk that's involved with this encounter? So we're going to use the example of like a cold and asthma. So say for instance, you come in and you have a cold. A cold is usually like a low level problem. Usually the provider doesn't have to order any labs or review any labs. They don't have to order any tests or review any tests. They kind of just listen to you, check your orifices, and tell you that it's a cold, tell you to get rest, drink plenty of fluids. That's pretty much it. So that's kind of a low level problem. You could probably get away with a level 2, maybe, a level 2 would be minimum because it's not a nurse visit. So it'll be okay to do a level 2. But say for instance, you come in and you have a cold, but you have asthma as well. You coming in and you are, you just got over a cold, but you have asthma. That's a chronic issue that you've always dealt with for your whole life. And it's pretty stable. You just want to come in to get it checked out because you just got over your cold, or you've been having this cold. And say for instance, the provider has to come in and, they look over, your past medical history, your caregiver, or if it's treating the child, the parent come in and kind of give a brief history of how the asthma's been going. So that is an independent historian. Maybe they look at, medical notes from your pulmonologist or your respiratory therapist from the past, and they consider that in this encounter, and they look to see kind of your history of your respiratory issues. So that's review. That's review of some data. And so that will be okay for like a low level, maybe a level 3 visit, because you have a chronic condition that is stable, and they did have to consider a couple other things, getting the information from a parent or a caregiver maybe, or looking over past medical notes from another specialty. Now, let's say, for instance, take that same asthma example, and you come in and you have some mild exacerbation. Maybe that cold, you had a little congestion and a little wheezing, and it's flaring up your asthma. The doctor listens to you and was like, oh, okay, so now I think I need to give you some kind of medicine. Now we need to like change your inhaler dose, a little bit, or give you like some kind of rescue medications. Maybe they still had to get information from a caregiver or a parent. Maybe they still had to look at information from a pulmonologist or from your respiratory therapist. But, it was still kind of moderate, but they still had to do more workup. So your asthma exacerbated a little bit. It's mild exacerbation, but it exacerbated, and they had to do some kind of drug management. So that right there will give you probably a level 4 visit, because, the risk of involvement, the risk of the condition is kind of increased. So they had to take into account drug management. So say, for instance, that same visit, like you come in, now you are a lot wheezy. Say, for instance, you have shortness of breath with that, and you're struggling to breathe, and it's hard and it hurts. You have pain with that. And maybe you have a fever as well, and maybe you're getting it's like severe exacerbation. Maybe you need a breathing treatment. Maybe your caregiver is giving, information on the history of it. Like, you started off with a cold, you got a little bit better, but then something happened and you had the exacerbation. The provider upped your medication. That did not help. Now you're coming back and it's severely triggered. And maybe, the pollen outside has triggered it. Maybe the weather changed. Maybe whatever it is. Maybe you had an allergic reaction. Maybe you was around a pet or something new that came into your environment that really triggered that asthma and made it worse. And so now you have an independent historian, a caregiver, or a parent telling the story for the patient. The provider is definitely looking at medical records from, providers. Maybe they're ordering some kind of breathalyzer test, how you breathe into the machine to measure, your respiratory, strength, your lung strength. Maybe they are ordering x-rays to see what's going on in your lungs. Maybe they're ordering some lab work just to see, if you're dehydrated or whatever else that they check for. And then maybe they decide that they want to admit you and get you some breathing treatments, and you have to be in the hospital. That is definitely a cause for a level 5 visit. So hopefully those examples will show you how you can determine how increasingly more work and that is being done with one condition that could increase the level of the visit. So we started off minimally with a cold, and we got all the way to severe exacerbation of an asthmatic patient. So I'm hoping that this helps. It's a lot more complicated than that, but I'm hoping that example kind of gets you in the right frame of mind of thinking. Again, I'm going to try my best to get a audit tool drawn up to kind of help. It's going to be something generic. It's not going to be anything official or anything formal. It's just something that I hope will help. And definitely do whatever your facility says that you should do in order to come up with a level of medical decision making. You should consult your clinic, your hospital, your revenue cycle department first. But hopefully this helps. Let me know if you have any questions.